events. And that's okay. Pandemics as mass disabling events. And you'll notice that the mass disabling events portion of the title is a quotation. And so here I'm quoting Amani Barbaran. She is, who says, and she's a prominent disability justice advocate and also a prominent TikToker. And she says, I can't stress this to you enough, but COVID-19 is a mass disabling event. People are becoming disabled because of COVID-19. And this society, she says, America in particular, is not prepared for it at all. Barbaran's claim that the pandemic is a mass disabling event is largely being borne out by the facts. Conservative studies estimate that between 10 and 20% of people who survive COVID-19 experience long-term symptoms lasting for more than 6 months after their initial infection. More recent studies suggest even higher numbers. Probably the most recent systematic review of more than 57 studies comprising over 250,000 COVID survivors suggests that more than half of people who survive COVID will have long-lasting symptoms. So the pandemic is creating millions and millions of disabled people. And importantly, long COVID can happen to anyone, but importantly, this pandemic created disability is not being borne equally. So women, especially middle-aged women, are more likely to develop the condition. Black and brown people who are essential workers, people who cannot work remotely, people who have less economic flexibility. These individuals are more likely to contract COVID and thus contract long COVID. In addition, disabled people, people who were already at greater risk of complications from COVID, bear the brunt of these disabling repercussions. In my talk today, I'd like to think a little bit about what happens when we put disability at the center of our pandemic narratives. So when disability is at the forefront of our minds, how does this change the stories that we tell? How does this change our pandemic histories, how we periodize pandemic histories when we understand when they start and end? And really, most importantly, how we put disability at the center of our story, how does this encourage us to respond to pandemics differently, right? So how would we respond differently if we center disabled people's lives and experiences, as well as the disabling consequences of disease? So today I'd like to make 3 suggestions or observations about this. And the first is that pandemics have long tails. They last for longer than case counts would otherwise suggest, changing how we periodize pandemic histories, right? So this suggests that when we periodize the pandemic history, it lasts for decades longer. Second, marginalized people experience the disabling consequences of disability at higher rates, right? So we have, certain people who are more susceptible to COVID, people who are more likely to contract COVID are also more likely to experience the disabling effects of this disease. Now and historically. And finally, we must center disability rights and justice in our pandemic response. And this also means centering the needs of people of color, lower income people, and others most impacted. I'm a historian of disability and disease, primarily in early America. So what I'm like to do is think about this and these questions historically, right? So make these claims by looking at a historical pandemic. And today I'm going to talk about the pandemic of smallpox that ravaged North and Central America and really beyond from 1775 to 1782. So 1775 to 1782. And you'll probably immediately notice that these are also the years of the American Revolution, right? So as British and American soldiers faced off on the battlefield, as society and politics transformed with revolutionary thinking, revolutionary ideals, people were also battling smallpox, and not only in the regions where the war was fought, but in places as distant as Mexico, Alaska, the Pacific Northwest, the Great Plains, and certainly the Eastern Seaboard as well. So just a bit of context. Smallpox is a horrible disease. It begins relatively mildly with flu-like symptoms, but and actually many people start to feel better after a few days. But then this relief is really fleeting. So painful lesions arise on people's skin, in their mouth, their nose, and their throat. A skin rash surfaces, which is kind of characteristic and persists with sores, cracking and running. Secondary bacterial infections easily develop during this time. If the sores run together, creating what is called confluent smallpox, the person's chances of survival really decrease. But even without this occurring, it takes weeks, 3 weeks, a month, for symptoms to improve in those who are lucky. And scabs might persist for a month or more after disease onset. So this pandemic of smallpox created a lot of disease and a lot of death, but it also a lot of disability. People who survived smallpox, people who had pustules on their eyes were left with reduced vision and fully blind. People had, I'm kind of quoting here, inflammation, fatigue, delirium. People develop intense scarring on the face and the body. Others lost the use of their arms, legs, and hands. These disabilities from smallpox were really prevalent across the population. But sort of back to that second point I was making, they were especially prevalent among those who had the least access to care and resources. So I thought I'd just give you a couple examples today. So first, there was a major smallpox epidemic among enslaved men and women who volunteered to fight for the British Army. So in 1776, Lord Dunmore, he's the governor of Virginia, he promised freedom to enslaved people who fled patriot masters to fight for the British. Thousands volunteered. Almost immediately, hundreds contract smallpox, and initially at an overcrowded camp at Tucker's Point and then on Gwynn's Island. Observers described, and I'm going to quote, hundreds of Negroes laying about sick and dying in every stage of the smallpox, taking refuge in hastily constructed huts. So really hundreds died, but also hundreds were disabled as a result of this experience. People describe them as weakened, blinded, continuing sick. I'm just going to give you one example. A preacher named Moses had smallpox on Gwynn's Island. He survived, but became blind and unable to walk. So another example of the disabling consequences of this pandemic, as smallpox spread westward, many Native peoples contracted it at high rates. And in fact, at such high rates that in many communities, there weren't enough people, healthy people, to care for the ill. Scholars estimate that more than 11,000 Native peoples died just in Western Washington, reducing the population by a third. Disability was prevalent too. Observers describe survivors as pock-fritten, as wounded, no longer able to hunt and fish. And just as an example, in 1806, when Lewis and Clark were traveling through the Cascades, they came across a woman, older Chinook woman, who they met, who they said was badly marked with the smallpox, which she had contracted about 30 years before. So as Native people were facing war and violence, settler colonialism, they were also facing the disabling consequences of this pandemic. And finally, some of the best records we have of the disabling consequences of this smallpox pandemic are from continental soldiers who applied for disability pensions from the new federal government. Many of these soldiers were from poor, really common backgrounds, including Samuel Bennett, whose story I'll just briefly tell you today. Bennett was a blacksmith from Fairfield, Connecticut. His neighbors described him as laboring constantly to support himself and family. So we wouldn't know about Bennett except for his extraordinarily detailed pension records. As he described in one of his petitions, he contracted smallpox while a prisoner of war where he was being housed on a prison ship and then a sugar house in really deplorable conditions. And so he writes, I'm going to quote him, "It was here that he contracted smallpox, during which time hunger and disease wasted his strength, that he could not stand, that he was brought bereft of his senses for more than half the time, laying on the floor, wearing off the flesh from the right hip until it was bare, and from which time," he says, "he has ever since been a cripple." So Bennett petitioned for a pension 5 times, only finally being granted one in 1818, 42 years after his initial injury, and just 1 year before his death. Sort of taking all these different stories of these disabling consequences of the smallpox epidemic, just kind of want to wrap up by thinking about what these experiences can tell us. And first, I really think centering disability in these stories elongates the time frame of pandemics. So when we pay attention to disability, we notice people suffering for years, for decades longer. So think about Bennett suffering 42 years later, the Chinook woman suffering, all the way in 1806, right? So paying attention to disability reminds us that pandemics have long-lasting consequences. Second, marginalized people are most affected, right? So people without adequate access to care, to resources, including those hundreds of enslaved men and women who contracted smallpox fighting for the British, these people are most affected. And finally, knowing this, we must center the needs of disabled and marginalized people in our pandemic response. Thinking about Bennett, right, waiting 42 years for a pension, receiving it only on his deathbed. So I think these kinds of stories encourages us to do better today, right, to provide greater support and accommodation, to do a better job of centering disability and disabled people in our pandemic policies. So I'll take a break there, but thanks for listening. Appreciate it.
Okay, can you all see my screen and hear me? Okay, great, thank you. So my name is Susan Mancino. I am an assistant professor in the Department of Communication Studies, Dance and Theater here at St. Mary's. And I want to begin just by thanking you all for being here this evening, and to thank Julia and Jamie for planning this series of lectures and for inviting me to be a part of it. My background is in communication studies and rhetoric, and much of my research focuses on philosophy of communication, communication ethics, and semiotics through the applied exploration of public commemoration in collecting institutions, so especially museums, libraries, and archives. I have an interest in health communication and the medical humanities, but I must admit that it is beyond my expertise, so I do approach the topic from my research and work on remembering and forgetting. My presentation this evening is on this tension between remembering and forgetting, and thinking about the context of the archives here at St. Mary's. So this project began from separate research that I am doing with Dr. Jessica Koblenz, who teaches in religious studies here at St. Mary's. And we're working on a series of projects exploring the legacy and ongoing relevance of Sister Madaleva Wolf, who is a well-known and well-commemorated figure on St. Mary's campus. Sister Madaleva's time at St. Mary's began when she transferred from the University of Wisconsin-Madison in 1906. She joined the Sisters of the Holy Cross in 1908 and began teaching at St. Mary's before the completion of her studies, which inspired her work advocating for educational opportunities for women. Her administrative experience began when she left for Utah in 1919 to serve as the principal of the Sacred Heart Academy, and a few years later, Madaleva founded St. Mary's of the Wasatch, one of the only women's colleges in the West. When she left her position, she spent a year traveling abroad, and then when she returned to the US in 1934, she was appointed as the third president of the college, and under her leadership, the college quadrupled its student body, tripled the number of faculty, welcomed the college's first Black student in 1943, and secured financial stability from a debt of more than $1 million. In total, her affiliation with the college spanned nearly 60 years, and her leadership made and continues to make a lasting impact on the culture and image of the institution. As Jess and I were exploring Madaleva's life and its surrounding context, one point that stood out to us was that Madaleva's time teaching at St. Mary's and her work, her graduate work at the University of Notre Dame, overlapped with the 1918 influenza pandemic, which occurred in the United States roughly from February 1918 until April 1920. We were interested in how this event shaped her experiences and particularly how it shaped the multiple roles that she played as a student, as a teacher, and as an administrator. Likewise, we were interested in how the pandemic affected St. Mary's as an institution, so we turned to the St. Mary's archives for more information. However, in our visits to the archives, we found no record of the pandemic or how it might have affected student and faculty experiences. So Jess and I turned to yearbooks and student publications such as Chimes for possible insights. We found entries addressing World War I, child labor, women's suffrage, and other events that defined this moment in history, but nothing on the pandemic itself. The college archivist, Eric Willerko, reiterated this absence, explaining that he had several other researchers who visited with similar hopes, only to discover the pandemic's absence in our collections. As I'm sure that we're all well aware, the 1918 pandemic was a major global crisis. It is estimated to have killed 50 million people and infected 500 million people, or approximately 1/3 of the world's population at the time. The first case arrived in Indiana in September 1918, and quickly prompting closures in churches, schools, and other public meetings. Although faring better than many other places in the world, the virus killed approximately 10,000 and infected roughly 350,000 people in the state of Indiana. Not finding anything in the archives, I turned to the newspapers. I turned to the South Bend News-Times, which reported on the spread of the virus as it unfolded on national and local levels. In surveying the digital archives of this daily newspaper, I found conversations that mirrored much of what we hear today. Suspicions about its origin, speculations about its impact on the upcoming presidential election, announcements of open-air church services, commentary on the effects of school closures, warnings urging the public to only visit physicians in the most urgent situations to minimize stress on healthcare systems, disappointment about disrupted social life, calls for more doctors and nurses, notices about the need for more masks and other medical supplies. And interestingly, the majority of the reports pertaining to the influenza's impact on local higher education in this Michiana region responded to its disruption of the Notre Dame football schedule. A headline on the front page of an issue on October 11th, 1918, pronounced rigid closures of public gatherings to ease the spread of the virus. However, this article announces that colleges remained in session, referring to both Notre Dame and to St. Mary's. And this article is the only article in the newspaper that refers to St. Mary's. And it references a statement that was made by the college indicating that there were no cases of influenza among the students at the institution and that there were no orders for the college to close. The information appears directly to the right of a heading, Chicago's death toll from flu, 155 in a day, and a few stories above a report explaining that the Indiana State Board of Health issued an order that health officials should put placards on outside of the homes of people who had influenza whenever it was certified by a physician. 9 days later, in an issue from October 20th, 1918, there was an article that accused the University of Notre Dame of attempting to keep student deaths from the pandemic out of public knowledge. The article states, quote, "Nothing is being revealed at school that may give the public an idea of how hard the epidemic has hit the university. And when a death occurs in the student body, the name of the student and the cause of death is squelched. Several cases of influenza have been reported at the infirmary. At the time, South Bend in the county was quarantined, but Notre Dame officials refused to adhere to the quarantine, holding out until the entire state was placed under the ban," end quote. There was no mention of St. Mary's in this article, or as I mentioned, in any other article in the South Bend News-Times. It's unlikely that the public statement made in early October 1918 would have been the last issued by the college, and it could not have been that St. Mary's as an institution or that its student body and faculty were unaware of the pandemic, making its absence increasingly curious and making the institution's response vulnerable to being forgotten. Rhetoricians and public memory scholars have extensively addressed the relationship between public memory and public forgetting. And in fact, the possibility of forgetting becomes one of the defining features of public memory's rhetorical nature. Public memory is rooted in the work of Maurice Halbach's theorizing of collective memory and the act of remembering together, as well as observations about the distinctions between history and memory. Carol Blair, Greg Dickinson, and Brian Ott recognize 6 characteristics of public memory, which are listed here. But their work relies upon the presupposition that there are multiple forms of remembering and simultaneously multiple forms of public forgetting. Their work complicates the assumption that memory and forgetting operate in binary opposition, and often discussions of public forgetting focus on the problematic implications of efforts to make the memories of people, events, and contributions vulnerable to being forgotten. These efforts demonstrate social justice implications, as the politics of remembering has most commonly displaced and at best minimized the contributions of women and people of color. Inclusion in collecting institutions has been a position of privilege with multiple layers of gatekeeping that welcome some while excluding others. And this exclusion poses questions of ethics about public memory narratives. Absence from the archives and other sites of commemoration implies that those excluded are unworthy for public remembrance in the privileged spaces found in these memory institutions. However, when we're looking at the St. Mary's archives and we're thinking about the 1918 influenza, this type of public forgetting does not quite fit. What we're seeing is not necessarily the deliberate strategic form of public forgetting. Instead, what is happening seems closer to Umberto Eco's description of forgetting as a cultural function. Eco was an Italian semiotician, medievalist, novelist, and cultural theorist. In 2013, he addressed the United Nations titled Against the Loss of Memory. Eco positions forgetting as a means by which cultures filter through the excess of information. For Eco, cultural memory does not have the resources or capacity to remember everything or to make sense of all that it has endured. Consequently, cultures filter through information, allowing some data to escape the bounds of its memory. So for instance, culturally, we remember the blood-stained pink Chanel suit worn by Jackie Kennedy on the day of her husband's assassination. We do not remember what was worn by Julius Caesar's life on the day of her husband's assassination. These distinctions are the product of cultural practices, and in this case, our use and reliance on photography and mass communication, and are reflective of cultural functions. Eco offers an example of forgetting in cultural functions, referencing common assumptions that the Middle Ages are marked by the presence of Augustine, directly followed by Aquinas, without recognizing that more time passed between Augustine's death and Aquinas' birth than Aquinas' death in today. So now in 2022, we are closer to Aquinas chronologically than Aquinas would have been to Augustine. Eco problematizes this forgotten context as knowledge becomes disembodied personally and culturally. These practices of filtration prompt public forgetting, but do not mean that the information is inevitably eliminated and permanently forgotten. Cultures tend to place some knowledge in latent states, hidden in messages and bottles for later discovery. Uncovering these hidden messages opens opportunities for renewed memory. We know that the COVID-19 pandemic has prompted renewed interest in memory about the 1918 influenza pandemic, placing many, such as Jess and I, in search of these messages. Scholars engaged in archival research work to uncover these messages, reinvigorating memory narratives and reinterpreting its meaning across a variety of disciplines. However, this work prompts important questions about the future of the archives in its memory of the COVID-19 pandemic. As we are all well aware, our communication and correspondence and other forms of archival holdings have largely shifted from written and physical material forms to digital and electronic platforms. This past semester, students from my organizational communication class visited the archives, and one student raised this question to our archivist. The student wondered what will be remembered about the COVID-19 pandemic from an institutional perspective, particularly in response to the 1918 pandemic's absence from the collection. The student recognized that our archivist's decisions actively shape what will be available to future researchers, just as the work of other collecting institutions. Their work in filtering through the available information and selecting what content demonstrates the practices and functions of our culture. Digital archives pose possibilities for archives. For instance, in Pennsylvania's Cumberland County, we see an effort to capture public notices that demonstrate how the pandemic affected public life. The Library of Congress is creating a coronavirus web archive, hosting a series of web pages aimed to a variety of communities and constituencies. And the University of Texas at Arlington posted calls to digital and physical collections with an emphasis on COVID-19 oral histories. This shift opens vast possibilities for collecting and accessing data. We live in an era that Jacques Derrida described as archive fever, characterized by an unbridled desire to collect and categorize what appears as infinite data sets. The implications of what this shift means for the future of memory studies and archival work is unclear. The digitization of archives brings limitations, vulnerabilities, and uncertainties as we entered into an uncharted memory terrain. And this future is yet to be determined as our collecting practices institutionally, personally, and culturally will landscape what will be remembered, researched, and forgotten about the COVID-19 pandemic in the future. Simultaneously, we will secure messages and bottles outside of institutional collections that carry forth meaning and insight for future pandemic researchers. All right, thank you very much.
Hi, everyone. Thanks for sticking around. We've decided to hold our questions until the end, so I will get started. My name is Amanda Gesselman, and I am the Anita Aldrich Endowed Research Scientist and Associate Director for Research at the Kinsey Institute at Indiana University in Bloomington. I am a social developmental psychologist by training, and today I'm going to talk to you about some studies that we've conducted over the first year or so of the pandemic, and specifically how they're impacting people's romantic and sexual relationships. So I know that we've been centering COVID as a few different things that aren't necessarily commonly publicized. And I think the most obvious effect of COVID is obviously the direct health implication, the respiratory virus, disease, et cetera. But I think that it's something that most people can agree on, that COVID has also directly affected us socially. It's also a social pandemic in a lot of ways. And COVID has done something really unique, at least for most of us in our lifetimes. And that is by centering relationship interactions as a source of risk or personal danger. Most of us haven't encountered that before, with the exception of, for instance, men who have sex with men who have been receiving messages like that, like public health messaging and campaigns since the 80s. So for decades, about how that relationship interaction, that intimacy is the source of danger or risk. But for most people, the general public, this is really unique, really unprecedented. And because of that, it's creating a barrier to how we have all throughout evolutionary history sought comfort, sought security, and sought a boost to our mental well-being. We turn to other people to get that. And so the pandemic has really changed our ability to seek those positive feelings. And of course, it's going sort of both ways, right? So for a lot of people, the pandemic has forced them into isolation. 37 million adults live alone in the US, and that's 15% of the total US population. These estimates were taken before the pandemic, so those might have changed. But for the people who are living alone, research is showing that they're feeling increasingly lonely and increasingly disconnected. And in relation to romantic relationships, there's a lot of frustration about having to take time off the dating market, especially for people who feel like they're in their prime years, or for people who want to have their own biological children. There's a sense of this sort of forced time out in the time that it needs to be happening. And there's also a frustration around a lack of autonomy. So a lot of people might not want to be in relationships or want to be pursuing relationships or sex or any of that, but the autonomy to make that decision for yourself is important, as it is in any other aspect of life. And on the flip side of that, forced sequestering also hurts. I think a lot of couples experience some growing pains at the beginning, and couples handle stress interdependently, meaning they handle it together. And so that means that the level of coping, the level of distress, stress, growth, et cetera, really depends on how they handle that together. And that can be good or bad, depending. So when the pandemic first happened, my colleagues at Kinsey and elsewhere were my colleagues and I guess, we were all very interested in what was going to happen, especially because it, again, was such a unique situation. It was really forcing people to immediately change their social behavior. And romantic and sexual relationships are a big contributor to well-being. They contribute to well-being over and above people's hobbies, career satisfaction, and even over some specific medical risk factors. So they're really important for well-being, and they also predict lifespan. So people who've had cardiovascular events are more likely to be alive 8 years later if they had better relationship functioning at time one. So they're very important, and the pandemic just had the capability of creating a lot of chaos and change. So we were very interested in figuring out how the pandemic would be impacting people's relationships. And we had some historical and theoretical things to pull from. So from a theoretical perspective, there are several social psychological theories that predict a specific way of reacting. So there's terror management theory, which is based on the idea that humans are the only animal that understands that they're going to one day die, and that fear drives us to want to create long-lasting connections. And then attachment theory also has the same sort of underlying concept, in that the attachment system activates in response to stress or fear or some kind of threat, and that creates the need to find your attachment figure, your other, and seek that comfort. And the same with Ten and the Friend. So all of these theories say that when there's some very stressful event, we should seek affiliation or comfort. And we see some evidence of that from prior disasters. So Hurricane Hugo happened in 1989, I believe, or at least in the early 90s. And research conducted over a 23-year period found that both marriage and birth rates increased in the 5 years following Hurricane Hugo in the zip codes that were affected. We also know about the baby boom after World War II with the increase in births. And after both the 9/11 terrorist attacks and the Oklahoma City bombings, divorce rates decreased over the next 5 or so years. So from this, we might expect that people going through the pandemic might be motivated to seek closeness and intimacy from their partners. So we might see positive growth in relationships. And also for people who aren't in relationships, we might see a bit more drive to find one. Oops. However, on the contrary, there are also a number of theoretical models that stress the importance of sort of additional factors. So we might turn to our close others for that affiliation, that comfort, but that comfort is only as good as both of our coping skills. So if I can't deal with what's happened to me and the person I turn to can't either, then that's not going to go well, even though I'm receiving affiliation or comfort, or supposed comfort. And research on experiencing personal trauma, so not societal wide-scale trauma, but things that have happened to a person, a very unique, difficult experience. Experiencing that is related to worsened relationship outcomes, to difficulties, to lower sexual desire, to less comfort with affectionate touch, to lower levels of constructive communication. So with these two together, we might expect that actually COVID might drive people into worsened relationships, worsened outcomes, or potentially drive people from wanting to seek those kinds of relationships. And currently, looking at statistics coming out of COVID-19, China, the UK, and Sweden are all reporting higher divorce rates and requests to divorce lawyers now. And in the study of Hurricane Hugo over 23 years, that study found an increase in marriage and birth rates, but it also found an increase in divorce rates. So while it was potentially driving more intimacy in a lot of ways, it was also creating a lot more potential conflict, or at least recognition that a relationship should end. So over the first year or so, my colleagues and I had some overarching research questions, which were, how is the pandemic impacting the quality of people's romantic and sexual lives, of course? If it is creating some negative aspects, where's the growth? What are the positives, and who's experiencing those? And finally, for people who weren't in relationships, what are they hoping to get after experiencing a year in lockdown or isolation? And so our first study we conducted in the first couple of months of 2020, of the pandemic in 2020 from March to May. And we collected about 1,500 participants here. I'm gonna quickly get through this so I can go, not take up too much of your time. But the things that we asked these people were, since the pandemic began, has the quality of your romantic life declined, stayed the same, or improved? And we also asked the same thing for their sexual life. So they could pick one of these options. And then we asked them about sexual frequency as well. So sexual frequency is tied to sexual satisfaction, which in turn is tied to romantic satisfaction. So you're trying to gather information on as many aspects as possible. So we asked them how often they had engaged in various sexual behaviors, including masturbating, having vaginal or anal intercourse, and they rated these on a 7-point scale from never to more than once per day. Okay, so in terms of romantic quality, we asked people since the pandemic began, which was within a month or so, has a romantic quality stayed the same, improved, or declined? And these are people who are in relationships, this whole sample. So they're reporting on people that they've been with since the pandemic started. These are not new partners. And about half of them reported that the romantic quality, the quality of their relationship, how happy they are, how good they feel that relationship is, has stayed the same within the first month or so of the pandemic. 30% of them reported an improvement. 2/3 of our sample were living with their partners, and this improvement was was similar across both of those groups. And so about 1/3 of each of those groups reported some kind of improvement in how they felt about their partner in terms of closeness, warmth, investment, etc. And about 1/5 of participants reported that their romantic quality had declined. This was similar across gender, age, and sexual orientation, and 1 in 5 experienced decline. In terms of sexual quality, there was about a 50-50 chance that people reported that their sexual quality had stayed the same or declined, with very few people reporting an improvement. And again, this was similar across gender, age, and sexual orientation. Actually, our only demographic difference here was whether or not they had kids. And people who had children reported significantly more decline than people who did not. So it went from 44 to I think 52% reported that they declined. But generally, it's a 50-50 shot whether or not people said that their sexual life declined in the first month. In terms of sexual frequency, all of those sexual behaviors that we collected, I didn't go into detail, but we had a list. All of them significantly declined in terms of frequency before the pandemic versus in the first month. And I think the best picture of this is in terms of masturbation, which we know is like incredibly common. So we asked people how often they had masturbated in the year prior to the pandemic, and only 2% of the sample reported none. So these people reported never masturbating in the year before. And when we looked at the monthly average, so this is on the same sort of scale, 20% of our participants reported no masturbation. And so I think that that's pretty telling in terms of how it kind of created an upheaval in everyone's daily life and routine. And around half of the sample had not engaged in any partnered activity at all during the pandemic, even though 2/3 of them were living with their partners. So to quickly go over this, what we found here, a significant proportion of people were experiencing changes in their romantic and sexual quality within the first month, and half of them changed in some way in terms of both sexual and romantic outcomes. But few reported improvements in their sexual quality in the first month of the pandemic. And this decline in sexual quality and frequency is important because that means much more limited opportunities for sexual growth, pleasure, need fulfillment, release, and this in turn factors into how people feel about their relationship in general. And so as the trend continued and pandemic stress persisted, it's likely that we would see more of a downturn with relationships. So nearly a year later, we were interested to see whether or not this had leveled out a bit or if things had gotten a bit worse for people as the pandemic had continued. So in January 2021, I partnered with the magazines Cosmo and Esquire to survey a nationally representative sample of 2,000 Americans These aren't their readers, they're just a truly nationally representative sample within the age range of their readership. And so this was 2,000 people based on the most recent census. So we asked our partnered participants, compared to before the pandemic, do you feel less attracted to your partner, equally attracted, or more attracted? For everyone, we asked, how would you describe the quality of your sex life? Did it diminish, stay the same, or improve? How often did you engage in sexual activity, much less, about the same, or much more? And for our single participants, we were interested in what they hope to pursue, if anything, once the pandemic is less of a threat. I want to emphasize that this was collected in January 2021, before vaccines were really, like an actual thing going to market. And so we thought it was going to be over in a few months. So this is I think a good look at what people might also be feeling at this point, now that people are again feeling like the pandemic is over. So we asked people who were single what relationships they hope to pursue. So nearly a year later, after study one, we wanted to see whether or not that quality of relationship had changed. And so we found that about a fifth of people reported declining quality in their romantic relationship. So we were really interested to see whether or not people felt less attracted to their partners after spending so much time either with or without them, and either with or without children in the house, et cetera. So I'm just showing you the overarching trend here. The overall sample actually reported that they're more attracted to their partner, and this was significantly different from the midpoint. People are genuinely reporting that they are feeling more attracted after a year, and that's held across gender, sexual orientation, age, education level, and income, as well as having children or not. So people on average are reporting more attraction. In terms of quality of sex life, this was a bit more varied. So the average is the midpoint of the scale, which means stayed the same. And the people on the tails here are actually, I think, where we would like place our interest, I guess. And so here we see that although about 300 participants reported that their sexual quality had declined, the proportion of people who reported that it had improved are about equal, and the proportions of these two are actually not different from one another. So most people reported that the quality of their sex life stayed the same, and then they had about an equal odds of falling to one side or the other. In terms of sexual frequency, we see the same thing, except that there are a bit more people on the left side than the right. So these are significantly different proportions, although just slightly. So some people, most people reported that they were having about the same amount of sex. It seems that things have within a year about evened out, although there are people who are reporting not bouncing back. And finally, in terms of what relationships people hope to pursue, 77% of the sample reported that they hope to pursue a committed relationship. So a committed, long-term, exclusive, boyfriend, girlfriend, et cetera, type relationship. About a fifth of them reported that they wanted to pursue friends with benefits. 13% reported wanting to pursue either uncommitted casual sex or romantic relationships without a sexual component. 5% reported wanting polyamory or consensual non-monogamy, which are relationships where all partners agree that it's okay for them to pursue other partners while still maintaining the relationship with one another. And 14% reported wanting a non-exclusive casual dating relationship. And about 1 in 5 of them reported not wanting a relationship at all when the pandemic subsides. So just to wrap it up, again, most partnered participants, most people who were in relationships, reported equal or more attraction to their partner compared to the year before. And some recent research has come out showing that people who are more concerned about COVID, people who are like engaging more in masking and taking it, more seriously, I guess you could say, are more picky in terms of their partner choices. They need their partners to be more attractive, to have more evidence of stability and family traits and things like that. And so it does seem that the pandemic is changing how people view partners and who is sort of a valuable partner. And I think that when we're looking at attraction increasing, this may be because COVID has genuinely led people to appreciate their partners more. Maybe people are picking up on those traits in their partners that are now more important for people who are, pandemic concerned. And this has led to genuine gratification, not gratification, gratitude and appreciation. Also, for study 2 compared to study 1, about a year in, sexual quality and frequency did seem a bit more stable. So it seemed to have leveled out a bit, which indicates that the tumultuousness of early pandemic life, while clearly it created a strain for some people that continued, it does show some promise for this intimate resiliency of being able to navigate the pandemic together. And finally, the vast majority, so 82% of those people, again, this was a nationally representative survey, 82% of singles wanted to pursue a relationship after COVID. And that was true especially for relationships that involved an emotional intimacy or companionship component. So committed relationships, friends with benefits, romantic relationships without a sexual component, those were the top 3. And although some of these can or cannot, do or do not involve sex, they all involve emotional intimacy. They all involve familiarity. And that seems to be the thing that's going to be important for people to be pursuing afterwards. Building on this point, singles make up a third of our adult population in the United States. There are millions of singles, and the majority of them want to pursue a relationship. As we're getting into pandemic fatigue again, it's likely that many of them have already started. And so this is both a huge risk group for transmission. They're meeting new people, they're going to restaurants, bars, etc. But it's also a huge group of people with a very unique challenge. And that's being alone, but very much wanting an intimate partner, which is, according to several theories, very much a psychological need. It's a very specific developmental need. And it's a huge sort of developmental barrier, a barrier to life satisfaction. And so this is a huge group who is navigating that, maybe already navigating that, and hopefully we can continue to track that and its effects. All right, hopefully I haven't gone over too much. Thank you so much, and I will stop.
Thank you so much. Thank you to all of you so much for sharing your insights with us. We do have a few minutes for Q&A. So if there are questions, if folks want to share questions in the chat or Q&A, I'll be happy to share them with our panelists. Maybe as we sort of start to wait and see about questions that might be coming in, I'll just offer one to start, which is just that it's really striking to me the ways all of your talks are thinking about sort of social transformation. And the sort of temporality of that social transformation. So the kinds of transformations that do or don't affect college campuses, Dr. Mancino's work, social transformation in intimate life, and Dr. Gesselman's work, the sort of long social transformation that might not be recognized in Dr. Daen's work. And so I just wonder if you might say more about, the way that your perspective on social transformation is impacting how you're thinking about COVID, or is impacting how you're thinking about COVID at this sort of strange moment in the pandemic, when it seems so unclear what stage we're in transformation. So I don't know if anybody has any thoughts about that.
I mean, personally, I think that we're probably going to see the effects of COVID on relationships for a long time, especially on loneliness. Loneliness has some physiological components, like the experience of loneliness physiologically changes a person inside, and some of those impacts are long lasting. And so I think that in itself is evidence that we're going to have some long-term effects of COVID for sure, especially socially related. But I think also just the things that people are navigating in their relationships and navigating, like figuring out how to end relationships or get out of situations that otherwise might not have been so difficult but are now. I think we're just going to see, like, unfortunately, a lot of societal trauma, I guess is the best way to put that. And a lot of it is centered around social connections, I think.
Yeah, I'll just add quickly that, so these talks were so great, and it's really fun to think alongside you both. In terms of social transformations, I think, as a historian, especially, really focusing on these kind of long-term effects, right? These effects that last for decades. And, I think with my talk, I really focused on some of the negative effects here, right? We have long-term disabling consequences. I also think that pandemics can be moments of positive change for disability rights and disability justice. So if you think about the polio pandemic in the mid-19th century or mid-20th century, this was really a crucial moment in the starting of disability rights, the disability rights movement. So there are opportunities here, even if there's really some kind of long-term disabling consequences. There's also opportunities to bring people together, right? We're having millions of people becoming disabled. Like, how is that going to change in terms of access, in terms of equality? So yeah, I think there can be some positive outcomes too.
Just really quickly, I think that it's interesting to think about public memory in terms of its, I guess, vulnerability or its characteristicness based upon present concerns, and how present concerns will carry forth certain aspects of the COVID-19 pandemic, or bring up aspects of the 1918 pandemic. So that tension between remembering and forgetting happens as these larger social transformations are happening, and it's kind of hard to predict where those will go, but I think it's an important point to remember when thinking about public memory.
Thanks so much. So we're getting very close to 7. And so maybe I'll just ask one more small question, and then we can end for the evening. And that question is a question about examples. So another thing that's really striking about your papers is that we have sort of like the archive as an example. We have the national survey as a way of getting examples, and we have like then historical anecdotes as things that can tell us something about pandemics. And so I guess I wonder if you have any thoughts about the sort of strengths or weaknesses of where we look for knowledge about pandemics. Where do we get knowledge? Where do we get knowledge we can rely on for thinking about either past or present pandemics?
I'll just jump in really quickly. I think so. Talking about early America, right? We have a really, some sources survive and some don't. And so it really shapes the kind of the stories that we can tell, right? And so looking at those disability pensions, right? These are some of these moments, like one of the few moments that we have really these people who survivor of smallpox, their own words, their own descriptions of their experiences. You can find those kind of variously in other types of sources, but these sources really don't survive. And as a result, I will say, in like kind of what scholarship is focused on, really focus on the disease elements, right? The actual moment of impact, and rather than like tracing that kind of long-term repercussion, that's much harder to trace. It's also not been really at the forefront of researchers' focuses. So I think disability often kind of, as a result of kind of what's available, disability has often gone by the wayside. But hopefully it's also really important, right? So how to kind of use the sources that we have to pull out certain kinds of stories. I hope that answered a little bit.
Following up on that really quickly, just to think about, again, like Echo's metaphor of the messages in the bottle, and thinking about how those pensions, right? Those requests, those submissions become those messages in bottles that hold forms of memory that otherwise have largely been forgotten on like institutionalized public memory narratives, and thinking about what other messages and bottles might our oral histories be carrying about the COVID-19 pandemic, or other sources where there is archiving, or there is memory work being done.
I think for me that it's important to have examples from a number of different sources, at least. So most of my work is quantitative, meaning people answer surveys and then it's translated in a number for me, right? But for COVID in particular, because it was so unprecedented for most people, we switched to kind of a half and half thing. So half quant, and then half of it was just, please tell us how you're feeling. Tell us what's happening. Because I can make up questions all day, but I have a very specific life, and that's not true for everyone. And so I feel like Otherwise, we would have just missed so much. And that data that people wrote for us, the things that people told us were things that I wouldn't have thought about, but that became really important throughout. Like, I don't have children, so I don't know a lot of those things, but people really gave me a lot of detail and insight in what they were willing to share, people meaning participants. And so being able to combine those two and say, yeah, you know, like the overall national statistic percentages say this, and that it actually seems to be true because people are saying that, you know, this is important to them. So that's what I try to make my, you know, example sources out of, to make sure that they're always a reflection of sort of both facets of that, what I've made and what people are saying.
Yeah, thanks so much. That's so interesting. Thank you all so very, very much. We are over time, just past 7. So I think it's time to say goodnight, but I just want to say thank you so much for sharing your work with us. And thank you to everyone who could join us. And thank you to Indiana Humanities and the NEH for supporting this series. So grateful for your time and grateful that we could be together to think about these questions. I hope you have a beautiful night. Thank you. And thank you to everyone who could come.